Get out of the fucking.
Okay. Hand hygiene. Hi, my name is Hannah. I'm gonna be your nurse today. Can I get your name and date of birth?
Hi, my name is Ellie Workman, and my date of birth is 01/22/2005.
Perfect. Today we're gonna be completing a head-to-toe assessment, and it should only take 10 to 15 minutes. Do you have any questions before we begin?
No.
Okay. And are there any allergies that I should know about?
No.
All right. Upon first examination of the patient, posture seems well maintained. She seems to have good hygiene and dressed appropriately for the weather. Patient seems to be in good mood and a cheerful mood. I see no lines, drains, or tubes. Are you in any pain today?
No.
All right. Patient does not seem to be in any pain. Do you know where you are right now?
Yes, I'm at Hannah's apartment.
Do you know what the date is?
April 11th.
And do you know who president is?
Mr. Trump.
All right. Patient is alert and oriented ×3. And then can I have you smile? All right. Face is symmetrical. Upon conversation with the patient, speech seems to be well maintained, no issues, no lisp or anything. And then patient seems to have the ability to hear and keep conversation. Do you wear contacts or hearing aids?
I wear contacts.
All right, perfect. I'm gonna go ahead and take a look at your hair and your scalp. All right, hair seems to be well maintained, good hygiene. I see no bald spots, lesions, or wounds in the hair. Can I go ahead and look at your eyes? Can I have you pull down your eyes for me? All right. The conjunctiva seems red and moist. The sclera is white. I see no redness or anything. Can I go ahead and take a look at your eyes here? Just look at my light. Perfect. And then can I have you follow my pen? All right. And then follow it inward and out. All right. Patient's eyes are equal, round, reactive to light, and accommodation. Can I go ahead and take a look at your ears? All right. Patient's ears are adequate shape and size, and I see no drainage. I'm gonna go ahead and take a look at your nose. I see no drainage in the nose, no deviated septum, and can I go ahead and have you cover one nose and blow? And then the other nose. Okay, perfect. Can I go ahead and look into your mouth? Patient has good dentition. I see no oral cavities. Tongue is midline. Patient seems to have good oral hygiene. Now I'm going to, and patient's skin seems adequate color throughout. I see no paler or any discolorations throughout. Next, I'm going to check your capillary refill. Perfect. Capillary refill is less than 3 seconds on upper and lower extremities. And then I'm going to go ahead and check your pulses. I'm going to check your brachial. Brachial pulses are +2 and equal bilaterally. Radial pulses are also +2 and equal bilaterally. And pedal pulses are equal bilaterally as well. Okay, and then next I'm going to listen to your heart. Patient has a strong regular heart rate between 60 and 100 beats per minute, and I hear no signs of S1, S2, S3, S4, or murmurs. And next, can I have you turn to the left? I see no signs of JVD, and I'm going to check your carotid here. Carotid has equal strength bilaterally. No bounding is present. And I'm going to go ahead and take a listen to your carotid. After listening to the carotid, there is no bruit present. It's equal. Next, patient's respiratory rate is equal and within 16 to 20 beats per minute. And when first examining the patient, I see no labored breathing or rapid breaths. The chest expands equal bilaterally. I see no signs of intercostal retractions or barrel chest. So I'm going to go ahead and take a listen to your lung sounds too. Just take a deep breath when you feel my stethoscope. And then can I have you lift your right arm? Take a deep breath. Perfect. And then I'm going to go ahead and listen to the back. Take a deep breath again when you feel my stethoscope. All right, perfect. Patient's breath sounds are equal, and I hear no sounds of bronchi, crackles, wheezes, or stridor, and they are equal bilaterally through the right and left lobes. Next. Oh, have you been having a cough recently?
No.
No, so no productive cough or sputum. When was your last bowel movement?
Yesterday.
Yesterday. Was there any changes to that, or is it the usual?
The usual.
All right. Is your bowel pattern pretty regular?
Yes.
Yes. When was the last time you voided?
Like an hour ago.
All right. And then, are you having any issues with urgency, frequency, or retention at all?
No.
No. Okay. And no changes in that throughout the last few weeks?
No.
Perfect. Can I go ahead and have you lie back here? All right. And I'm going to assess your abdomen. I'm going to go ahead and assess your abdomen. On first inspection of the abdomen, on first inspection of the abdomen, I see that it is flat, normal color, and it's not distended. I see no visible pulsations or masses. I'm going to go ahead and take a listen. The patient's abdomen is equal and reactive. Bowel sounds are equal and reactive, and bowel sounds were heard in all 4 quadrants. I'm going to go ahead and start palpating your abdomen. Tell me if there's any tenderness. Is there any tenderness there?
No.
All right. Patient's abdomen was soft and non-distended, and there was no tenderness present. I can go ahead and have you sit up. Next, we're going to assess your range of motion. So can I go ahead and have you lift up your arm, and then out, and then up. Perfect. Patient has full range of motion with no crepitus. I'm going to check this arm, and then out, and then up. Perfect. No crepitus was found in either of the upper extremities. Can I go ahead and have you kick out your legs? Perfect, and put them back in. There was patient has full range of motion in the legs with no crepitus present either. All right. Now can I have you turn your head that way, and then towards me, and then up, and then down. Perfect. Patient also has full range of motion in the head and neck with no signs of crepitus. Can I have you go ahead and stand up? And then can I have you walk that way? And then turn around and walk heel to toe. All right. Patient has an appropriate gait with equal balance. On the assessment of the patient, the skin is equal to their ethnicity, and I see no lesions, patches, or wounds, or edema. And then I'm going to feel both your upper and lower extremities. Patient has equal temperature bilaterally through the upper and lower extremities, and the patient's skin is warm, dry, and intact. And then I'm going to go ahead and assess for turgor here. I'm going to pinch your collar here. No tinting was present. All right, and that concludes my assessment. Is there any questions you have? Perfect.
No.
I'll let the provider know that you are ready to see them. Thank you.